It's an interesting case that we came across a few months back. It's a 14-year-old child by name Muhammad from Afghanistan. Unfortunately, this child was involved in a trauma, and apparently, as his brother mentioned, that when he was 4 months old, he fell out of the crib and he hit his face, and they didn't think about anything at all at that time. And subsequent to that, gradually the child started to have problems with speech and speaking. So for a while, they thought there was something wrong with him, and eventually, when he grew up to be 4 years of age, they realized that he couldn't move his lower jaw, and he couldn't talk, and he couldn't basically stick his tongue out or eat. And the force of his tongue was able to push his front teeth out a little bit, so they were feeding him with a straw. At that time, they took him to Germany with as part of a charity program, and they tried to open his lower jaw. And most likely he had some what we call fusion of the condyle as well as the temporal bone. So when you get what we call ankylosis, the upper jaw and lower jaw fuse to skull, and the child is not able to grow, so the lower jaw gets stuck. And so over the past 10 years, he had not been able to basically open his mouth and eat or brush his teeth or anything that normal child was able to do. So they seeked us out, and he came to see me, and we got scans, and we did stereolithographic model, and we realized that yes, his condyle on both sides and his coronoid process on both sides had been fused to his temporal bone and zygomatic arch. So we had a full discussion with the family, and they told him that he's only 14, his growth has not been completed. Our main goal was initially to just take him to the operating room and open him up and allow his jaw to open, and is able to get inside his oral cavity. He had not seen any healthcare profession back in Afghanistan, as you know, because of the war and all the chaotic situation there for past 15 years. Anyhow, so we took him to the operating room, and through a preauricular approach and submandibular approach, we opened him up and resected the portion of the jaw that it was fused to his temporal bone, and took out the part of the coronoid process on both sides, and took a piece of rib from his rib cage, cartilage from there, and then put that in there to stabilize the area so it won't refuse again. And we're going to allow him to grow and finish his growth. And eventually, I'm going to do a total joint reconstruction for him with customized titanium condyle and prosthesis to allow for him to have a normal function. He will have a dental-facial deformity at the current time because his lower jaw did not grow, and his upper jaw continued to grow. So in other words, he will have very little adaptation between his upper jaw and lower jaw if the lower jaw doesn't grow as much. So the operation was very successful. He was able to open his mouth, and he was so excited that after 10 years, he was actually open his mouth and stick his tongue out. He was able to brush his teeth and start eating, and his speech is also going to be improving. Because remember, if you can't open your mouth, your tongue is not going to be able to move, and your speech is altered. So they thought he had some sort of mental retardation because he was not able to talk. And now he's getting speech therapy and he's starting to eat, and he's a happy boy. And you know, we take so many things for granted that if you're able to do your normal routine as a child, you know, that's just like, okay, he's supposed to be doing that. But when you're stuck and can't do normal routine, whether it's talking, swallowing, speaking, brushing your teeth, eating, it's devastating outcome. So they're very happy, we're happy, but he's only 14, and this is just a temporary fix for now. I'm going to wait for him to continue his growth, and between age 16 and 18, that's when majority of the growth has been completed, and at that point, we'll bring him back and do a new set of scans on him and get his orthodontic work done, and then do major reconstructive surgery to basically reconstruct his lower jaw and his condyle bilaterally and let him have a normal life.